This is nasogastric tube insertion. Assemble equipment. Stand on the right side of the cot if you're right-handed or vice versa. Patient should be in Fowler's position. Place bath towel over client's chest. Give facial tissues to client. Instruct client to relax and breathe normally while including one nares. Repeat with other nares. Select nares with greater airflow. Measure distance of insertion by placing tip of tube at client's nose and extending tube to tip of the earlobe and then down to the xiphoid process. Mark length of tube to be inserted with a piece of tape or note distance of point from next to marking.
Show me the mark. Just show me the mark on the camera. Okay.
Move it.
Okay.
Instruct client to extend neck back against pillow. Insert tube slowly through nares with curved end pointing downward. Pass tube downward, applying gentle pressure to advance. Use other nares if resistance is met. Insert just past narrow nasopharynx with gentle rotation toward opposite nares. Stop advancement and allow client to relax. Explain that next step requires him or her to swallow. Instruct client to flex head forward.
Put the head forward.
And dry swallow or suck in air through straw. Advance tube 1 to 2 inches with each swallow.
Give him the straw. Zach, hold the straw up there.
If client has trouble swallowing, offer a glass of water with each advancement of tube. If client begins to cough, gag, or choke, stop tube advancement and instruct client to breathe. If coughing continues, pull tube back slightly. If gagging continues, check back of pharynx using flashlight and tongue blade. After client relaxes, advance tube to desired distance. Check placement by asking client to talk. Check posterior pharynx for presence of coiled tube. Attach cone-tipped syringe.
Just look in the back of the mouth again. Okay, good.
Attach cone-tipped syringe to end of NG tube.
It's right over here on the table.
Attach cone-tipped syringe to end of NG tube. Aspirate back in syringe to obtain gastric contents. If no contents are aspirated, ask client to roll onto left lateral position and check again. And inject left upper quadrant. And inject 10 to 20 cc's of air, listening for whooshing sound. If tube not in stomach, advance another 1 to 2 inches and repeat previous step. Clamp end of tube or connect to suction.
Okay, just take that connector, that spacer right there, that's on the table.
Yeah.
Stick it in the tube where that syringe is, and then hook that blue end up to it, and that's clamped.
Tape NG tube to client's nose. Split 4-inch piece of tape lengthwise 2 inches. Place unsplit over end over bridge of nose and wrap strips around the tube as it exits the nose. Then you're going to fasten the end of the NG tube to client's gown. This, I assume?
Yep, just pin it where the...
Pin it to the gown and provide slack for movement. Apply Vaseline to nostrils to prevent crusting and to the lips to prevent dryness.
Just pretend like you stuck your finger in something and put it on his nose and lips.
What?
Vaseline on nose and lips.
So just pretend like you're stuck...
And then position head of bed at 30 degrees elevation.
Okay.
Unless otherwise ordered.
Okay.